I'm Diane Brady. I'm a public health nurse here at Fairfax County Health Department in the Springfield office, and I work in tuberculosis. Here in the health department, we actually have 3 people involved with every patient. It would be the nurse, the physician, Dr. Andrino, and the outreach worker who sees them almost every day for the medicine, taking the medicine. And also we can go speaking to or communicating with in other ways, faxing their treatment plan to other physicians, because that's how we actually get the patient, normally through other physicians, sometimes in doctor's offices and sometimes in the hospital. It can be anywhere in the body actually. So it can be in the bone, it can be in the lymph nodes of the neck or anywhere the leg. It can be in the meninges, which is around the brain. So people present in all sorts of ways. It's not just in the lungs. I'm recalling a patient who had the tuberculosis in her spine. So this one was from Bangladesh, but I've had one from El Salvador. And the fact that they are pretty much in pain before they see us, normally in the beginning of their treatment, they always feel better by the end of our treatment because the medication really hits the tuberculosis and takes it out of their body. So this person was actually in a wheelchair when I first met her and couldn't walk. But in the end, she walked perfectly fine. You really build a relationship with the patient. It is a long treatment. It is normally at least 6 months. But I think we do a really good job, and then the patient and their family appreciates us. And we see that they're getting better, and we kind of work them through the process. So it's almost like we're their cheerleader and their healthcare provider.